Hello, everyone. I have a wonderful patient. She's 7 weeks out from her saline implants from 2003. These were 270 saline. They were filled to almost 330 or so, plus minus. And she's 67. Now, clearly, looking at you, you did not need a lift. And number two, you clearly did not need drains. Now, let me ask you a question. How are you doing now, like 7 weeks after your explant surgery now?
Amazingly good.
Yeah.
I
How
feel
are the
really
symptoms?
healthy.
What were your major complaints before the surgery?
Fatigue, and then I had a very lower back pain, and then dizziness, and the hot, cold. I couldn't stand hot or cold out. The hot summers, the cold winters. But now, pretty much that's all subsided. And now I have I can think clearer. I have more energy. The days are like they used to be when I was younger.
Good, good, good. Now, next question for you is, did you need a lift?
No.
And now, how sure are you? Because you're 67, you had the very average size 325, 330 cc saline implant. How sure are you?
How sure?
That you did not need a lift?
Oh, totally, because I knew I was small from the beginning, and then put those big things in, and now that they're out, I feel like I'm back to who I really was, my normal self.
And natural self, without any cutting around the nipple areola, without
Yep.
cutting up and down. This was just a horizontal incision. And I have to say, your surgeon did an outstanding job, which made my job easy, by the way. If you have a good surgeon who's augmenting, then certainly the post-op result, aesthetic post-explant, is also easy. How was your anesthesia?
Good. Very good.
How was your pain control around that? On the day of the surgery and after?
Very good, actually. It was very good, and even I probably could have stopped taking the pain meds earlier than I did. I took them, and I probably really didn't need them. I was just thinking,
No, I want to mention you did an outstanding job listening to all my instructions down to the T. You were very meticulous, detailed. You saw and followed along with me, all my instructions. And if you're ever in doubt, you did not do it. Trust me, that made me sleep better because I knew you were following the instructions. Sometimes, I say don't test the surgery, by moving your arms. Just like after a tummy tuck, you don't want to be bouncing around up and down, right and left. You want to be very slow and very systematic in your movements, and I appreciate you doing that. And you truly were outstanding in how you followed my instructions. Now, anything you want to mention to someone who says this is a placebo effect? This is in your mind. The most common complaint being fatigue and brain fog also up there. But fatigue is the most common complaint. For someone 67, what would you say to that other doc or plastic surgeon or a significant other or the patient? Oh, this is just coincidental.
Nope. It is totally it. And I started feeling 3 or 4 years ago, because I was very healthy as a young girl. I was real athletic and everything. And so you can tell when your body's not right. And I knew something wasn't right. And I was eating really clean, good food, and I was doing the right things. And then when that clean eating didn't help anything, I thought, there's something else. And so I had found the website or found the Facebook and started totally listening, because I didn't want to go into a surgery at my age. I thought at this age, no way. And that scared me the most. But when I kept hearing the stories over and over and over, and they all were the same, I thought, Cindy, take them out. That's the cause. And sure enough. So I got the courage, and I thought I'll be fine through all the pain. And it was nothing what I thought it was. So to me, it was easy. And I'm glad I did it because it did make a difference. It's true, and it's not in my head.
Yeah, no, thanks for sharing. And I'll tell you, your gut basically is you followed your gut. Your gut's not wrong, and you know it. And the many, hundreds of thousands of ladies who are explanting, they are not wrong. They know that it's the implant still. Even if you're 67, someone will say you're old, your joints must hurt. It's the cold, it's the stresses of life, God knows what not else. It's the implants because they're not lifetime devices, and there is a pattern recognition. Yes, we don't have labs, we don't have an imaging diagnosis. This is where you have the peace of mind. All of that capsule and inflamed tissue was removed, and that all of it was tested. Now, thanks for sharing your journey.